Okay, so what we're going to do now is we're going to do, if you guys get a close look at David, he has just fine little scars here. And is this acne, David, that caused these scars?
Yes.
Okay, great. Okay, so what we're going to do is Bolotero is one of the newest fillers on the market. Does anybody know the difference between Bolotero and Restylane and Juvederm and all that? I'm sorry? It's finer. Yeah, finer. I'm sorry?
It's a different manufacturer, probably has different cross-linking.
Different cross-linking. Okay, so you've got these molecules. Think of these as my hands as molecules. Okay, so these are particles of the hyaluronic acid. Hyaluronic acid is basically like a jelly, and so you have different cross-linking, and that's just bonds that hold the molecules together, or the jelly together. With Bolotero, Juvederm has the highest cross-linking, so it's really bound tightly together. Restylane, they say, has what the body naturally has for cross-linking, so they have a little bit less of the cross-linking than Juvederm. And then Bolotero has even less of the cross-linking, so the molecules are less tightly bound to each other. So the theory is that because they're less highly bound to each other, they're not going to be quite as lumpy underneath the skin. So you can use it for finer lines, finer wrinkles, finer scars, and things like that. So that's the big difference. And so with this, what we like to do is we like to take the needle and we like to have the bevel up here. We like to bend the needle just a little bit to make it easier to insert in the skin. So what we do is we just basically look at these scars, and he's got a scar here. And so what we do is we just go right underneath the skin, and then we inject just little bits of filler underneath the skin. And when we do this, what we're doing is on these little fine wrinkles, we're actually doing a little bit of a subcision, because you can see I'm actually stabbing underneath the skin. And so you're basically breaking up that scar tissue underneath the skin as well. And you see how I'm staying right underneath the skin when I do this? You can actually see the gray of the needle when I do this. And you want to just inject little amounts underneath the skin. How are you doing, David? Are you in pain?
Yeah.
All right, thank God. Now we all know David's not a liar. If Julio were up here, who knows what kind of answer we'd get. Julio's a notorious liar. Okay, and so you can see we just kind of go into each one of these individual scars and we go back and forth, and we just try to get really superficial in the skin. Because if you go deep, it's just going to spread around the scar and it's going to create that donut effect. And now David's are really teeny, so
how long will that last?
The Bolotero is a little shorter lasting than the Restylane and the Juvederm. So with Juvederm and Restylane, they say it lasts 6 to 9 months. Okay.
But the fact that you're doing the subcision might actually have some longer improvement, right?
Exactly.
How bad does it hurt on a scale of 1 to 10
Probably like sticks.
David's tough.
But you usually know.
Yeah, usually patients will have been numbing for anywhere from 10 to 30 minutes.
Because he doesn't have that luxury.
But it's surprising though, those little needles, I think the size of the needle actually helps the pain level, because it goes in. Yeah.
Okay.